And welcome back. And we're getting ready to move into our first conversation for today, finding out about a very important program that is being coordinated through Unicef and the Ministry of Health and other partners. And we're going to get all the details about it with our guests this morning. We have with us Dr. Marta Segu, Executive Director of PROBATES Foundation. We have Dr. Ramon Figuerora, who is the Chief Executive Officer for the Ministry of Health. And we have Dr. Susan Kasedde, Unicef Belize representative. Good morning and welcome, and thank you for being here.
Thank you. Good morning, thank you.
All with great energy, that much we could tell you. And the conversation before was if you're a morning person, but it's a lovely Friday morning. So we've got it going on, Unicef Capacity Development Mission. Talk to us about it.
Thank you. Thank you very much for having Unicef on the program. Unicef has been working as a partner with the government of Belize and with the Ministry of Health in Belize to contribute to improvements in child health and development. This is part of our shared goal to see rapid and sustainable improvement in health indicators for children across the country. Yeah. There are about 109,000 children under the age of 5 and primary school age in Belize, and our challenge in Belize is to ensure that we invest in systems that deliver better health and better opportunities to see these children through childhood so that they are healthy, safe, productive, and able to contribute from their full potential to growth and sustainable development in Belize. And that's our shared goal that will be contributed to through this project that's supported by the PROBATES Foundation.
Okay, so let's start with Dr. Segu for a bit to learn a bit more about PROBATES.
PROBATES is a non-profit foundation that was created in Barcelona, Spain in 2008. And we start with international cooperation projects to improve health of most vulnerable communities around the world. Our target are children and mothers. So that's why we work with UNICEF and other partners in other countries. PROBATES Foundation aims in this project that is called Global Laboratory Initiative. It's really to improve the diagnosis of most prevalent diseases in each area of the world where we work. So in the case of Belize, we have been working very closely with UNICEF and the Ministry of Health to improve the health of the most vulnerable population, especially children and mothers.
That's right. Now, Dr. Figueroa, let's set the backdrop here a bit, because we're talking about strengthening medical laboratories specifically through this project. And we know that there are certain facilities, or private and public facilities, that do offer laboratory services, but this is going beyond what the general population has been able to access, right?
Yeah, well, actually, the project focuses the remote areas in the south. We're talking about Toledo and Stan Creek, particularly Southern Regional Hospital, and I think maybe we could talk a little bit more about the visits that we had a multi-sectoral team visiting the facilities down south. But certainly from the perspective of the Ministry of Health, remember we also have national health insurance down south. One of our weak areas has always been, and we were discussing that yesterday, was the whole area of independence, because we seem to have a major influx in that area from across the border, migrant population. It's also an agricultural area. So our system, our lab facilities, our medical facilities have been sort of overwhelmed. So this is a welcome support, because we have had to actually contract out some of the lab services to the private sector, and it's become a bit unsustainable for us. So this support for the Ministry of building our capacity is going a long way in terms of providing good service, particularly for mothers and children, but for the population at large.
Now, are we talking, when you say building capacity, a lot of times people think about human resources, but does this project also include infrastructure work?
Yeah, exactly.
Yeah?
Yeah, the idea of the project, we have different support areas. One support area is infrastructure in terms of water, sanitation, in terms of electrical power, in terms of capacity of the space, building a space, rehabilitation of spaces. After that, the equipment of the laboratory, it's very important, the equipment of laboratory, because some of the centers and laboratories that we visit during the trip, they are very well equipped, but there are others that need a lot of equipment. So we're working on we are focusing on Independence, for example. We are focusing on San Antonio, for example. But Punta Gorda, they have a lot of infrastructure already in place. They have a lot of equipment. So we are going to focus on the areas that we find there is a gap. Yeah. So there is infrastructure, equipment, and training. Training of the local personnel. But they have to tell you that during the trip we realize that the skills of the personnel is very high. We're really impressed about that because people are well trained and they are working very, very hard and very committed. So we were impressed, especially in those areas that we visit in the south, that the people are really very well trained. So we'll do and we'll cover the gaps in the training that we identified during the next 2 years.
It seems indeed, Dr. Figueroa, that this is actually a blessing to the Ministry of Health. And how are we embracing this help?
Well, about a year or a little bit more, I think we were approached through Unicef with the possibility of developing this project, and so we quickly jumped on it. Actually, I was sharing with Marta yesterday that it was the first time I had heard about PROBATES, and it's been a wonderful experience. I think with the help of the Dr. Morazan from our central medical lab and working closely with Unicef, we developed this proposal, and as I said, welcome support, particularly in the south, where we needed to. We already had some investments in the south in terms of lab support, but there were certain gaps that we needed to fill, and I think this was a welcome support. And I think the team that went out this week to do an assessment, part of the feedback we got yesterday, it's good to hear that we have people who are. We usually hear about the people who don't do the work, but rarely you hear about the people who are committed, who do excellent work, and that's what we heard yesterday from people, lab technicians, phlebotomists doing expanded work in rural settings, going beyond the scope.
Let me jump in here because I think Dr. Kasedde, you can shed some light as well as the rest of you. We've known for quite some time that Unicef does have a specialized focus in the southern portion of Belize, and that is because the statistics that come out from that particular area, when you dissect what the overall health statistics are saying, there are some challenges specifically in the south. How will this project, I see specifically two things. It's strengthening human capacity, training more lab techs, but also very key is decentralizing the laboratory process. So many people who haven't traveled to the south may not know the challenges in moving from San Antonio or Mafradai to Punta Gorda, or from the river valley into another area. So you're decentralizing the project and maintaining this focus on the south. What are the specific indicators that you're hoping to change by doing this project in this specific way?
All right, so I think that you've touched on something really important, Marlene. Through this project, we look to try and contribute to several things, but I think the most important thing is to not only improvements in the infrastructure, as we were talking about and hearing from Marta just previously, but it's the quality of service. The quality of service, the timeliness of delivery of results, so that when a mother comes into the facility with her sick child from the village of Trial, she doesn't have to go back and reinvest her time and resources to seek results that she could have received sooner, so that she doesn't have to wait so many days to receive the treatment that she needs to urgently address the health condition of her child. So we want to improve the performance of our health services, the quality of the health services, and by extension, therefore, the other indicator is the health outcomes for our children, for our families. So at the highest level, this project and our work more broadly through Unicef really aims at improving the health of children and families. But I think it's important to note that while the focus may be on investing directly in infrastructure and capacities for lab diagnosis, we recognize that an important part of this, a central part of this, is our partnership with communities, because health is made and broken in communities. It's sustained in communities. And so an important part of this is using the data and the lessons that are coming out of this project project about the health of our communities, to prioritize more effectively the kind of health education, the kind of support that's provided in the communities to protect the health of our children and families, and make sure that ultimately the burden, the demand on health services and the limited human resources that we have for health is reduced, and that services can be more efficient in responding to the urgent needs, the urgent care needs.
If I may just add, remember that lab services, imaging services are really support services for the human resources that we have out there. So for them to be able to provide quality services and to monitor what they're doing, they need all this kind of support. And so that's where it's so important to have the availability of lab services then and there at the place where you're delivering a service, so that you can, in fact, know immediately whether whether you have a serious problem. Particularly we're talking about chronic non-communicable diseases, diabetes, and so on, where you need lab tests and to monitor the treatment. So performance is measured sometimes by the results, immediate results that you can have through a lab service.
I absolutely agree with what they said, but I only would like to add that this is even if it's a laboratory, strengthen health services and laboratory facilities, it's a community project as well, because the laboratory is the entry point to a vulnerable community with all other health programs and problems. So we want to support communities in terms of what Susan said and Dr. Figuerora about health education, about prevention, about make available to vulnerable communities these lab services for the doctors to manage the treatment and the monitoring of the diseases. So it's a community work, it's a laboratory work, it's a staff, it's training, it's a very comprehensive project.
Are you going to be pulling from the direct communities in terms of the human resources that you want to be able to develop?
Yeah, I think, again, a really important point, because while the capacity development that's going to be supported directly through the project is focused on lab capacity.
Specialized skills,
That's right. As a program and as a partner with the Ministry of Health, we recognize that that's only one aspect of the human resources that we need to have skilled, available and accessible to communities to assure the best outcomes in health. So we need to have community volunteers who are knowledgeable about diabetes, about heart disease, about nutrition, about acute respiratory infections, so that they can give basic information to families in the community, so that they can better understand, recognize the risk, respond to these risks appropriately, and therefore reduce the demand for urgent critical care in hospitals and illness that results in a hospital visit. So we really recognize as UNICEF and invest through our program in advocacy. We have an early childhood development and education program that engages parents as partners in healthy development in children. We partner with schools because they too play a critical part in through the curriculum in educating children and adolescents about health.
And since the rollout of the project, like you rightly mentioned, you need to get folks to eventually continue to help out. What's the relationship like with the communities and the whole rollout of the project?
We are going to start the first year in infrastructure, rehabilitation of laboratories, equipping the laboratories, training of the staff. And the second year is focused more on community work. So the idea is to identify with UNICEF and the Ministry of Health how we are going to work with the communities in those areas to involve them, because we want people to understand and to know that we are working on those laboratories and they can work, they can go there, they're going to be treated, they had access to lab services there. So we have to work with communities, not only for health education, but also to encourage them to use those facilities that will be now with full capacity.
The other thing is that there's been other initiatives down south, and I think this is now linking with those. I think we will not revitalize some of those the investments that have been made in the past. For example, the Japanese development project that where we developed a good curriculum, dietary guide. We developed health education that's adequate for schools, that's culturally sensitive. And so we have wonderful material that now we can reuptake, if you want to call it that way, and reutilize that and revitalize it and use that. And it's been done through the participation of the community, with community health workers, with the Ministry of Education. So if we can expand that and make those links again and re-energize the process, because most of the times we start projects and then they die off over a long term. But this is, I think we're creating those links, integrating, and we can use past experience and past projects to...
And it does have, once established, a more long-term impact. Now, I'd want to ask, and this is based purely on assumption, I should say, I would imagine that this would improve the full understanding of the health profile in that area. One would assume that near a border community where it's probably very prohibitive to travel into an urban area, that it would be easier to just go across the border. Do we have very clear statistics in these rural communities, or will this project help to change that?
Statistics in terms of...
the health profile, who's suffering from NCDs, what's the...
We have information in the South in terms of what that sort of profile, but as I said, the lab support services tends to make it a lot more timely in terms of your diagnosis, and a lot more accurate, validates your clinical diagnosis. And for management purposes, it's important sometimes to have that quickly. If the pregnant woman comes in and you don't have the results of the hemoglobin, which is important. When the before sometimes you have to send it all the way to Dangriga. But when the results come back, you can't find the mother. Or in PG, or in most areas, because it's difficult. You're right. In terms, a lot of people don't understand the difficulties of traveling in the South. The amount of time, sometimes it's one bus coming in the morning, early in the morning. We're talking about early morning, we're talking about 3 o'clock in the morning. And then they go back in the evening.
You have to leave at about 12.
Or the financial.
And financial, the implication. So having that service available in Santa Teresa, which is one of the areas we want.
We have seen these days with the trip.
Makes a huge difference for people.
As you mentioned, go ahead.
Sorry, I just wanted to add that one of the things that I was really impressed by when I visited the health facilities in Dangriga, Hopkins, Independence, and Bella Vista was the Belize Health Information System. Because in our experience through UNICEF, and we work in 190 countries across the world, we have witnessed countries struggling to put in place a system that connects different facilities to track and create profiles of health profiles for the communities that they're serving. Belize has already established that, and I think we need to acknowledge the leadership and the investment that has gone in to create this critical information system that will manage and help us better safeguard the health of Belizeans. But in addition to that, UNICEF has been partnering with the Statistics Institute of Belize to establish specific statistics on children and households, and we've just completed the multiple indicator cluster survey for 2015, which complements routine data such as is generated through the Belize Health Information System, and help provide a more enriched understanding of the health and vulnerabilities in our community, and inform our programs, because our programs have to be smarter, they have to be more effective, they have to be more creative in order for us to achieve the kinds of impact and acceleration that we need to achieve the goals that are outlined in our different development strategies. And that's where, again, we have resources here, rich resources and statistics that can help us get to that.
And evidence-based, working on a problem that we know exists. Now, one of the things I appreciate about Southern Belize, and it's a bit of a cultural nuance in terms of working with community established healthcare workers, your traditional birthing attendants, your midwives, and other persons who've been identified in the community to assist with healthcare needs. Will you be reaching out to these individuals to have them be able to understand how sometimes a clinical diagnosis, not just a clinical diagnosis, but going in for a lab test to check glucose levels if a mother is pregnant, if a woman is pregnant. Will you be working with them to have them buy into the new services that will be established as well?
Certainly. Yes, the quick answer is yes. Community health workers and traditional birth attendants have, over the many years, been probably our contact with the community, have been our presence at the community level. They have done great work. Yeah. But one of the things that I was sharing with the group yesterday is that sometimes we overburden the community health workers. Everybody comes in and they oh, the community health worker, you want this, do this project and do this report.
About safe water.
And yes, and they get tired sometimes, and so we have a high attrition rate sometimes. We need to be careful how and respect the time that they have that they have available. So, but yes, we want to work with them. But we also want to change the focus a little bit more. We're having in other projects trying to see how this works. Instead of just working through a community health worker, work through village leaders and organize the village and have true community participation, as opposed to, because traditionally we use a community health worker and say, all right, this is what Ministry of Health wants. This is what Ministry of Education wants. Do it the other way around. What does the community want? Yes. And then let's work in partnership. Let's have more respect for what the community wants. Eventually, they'll get to the health problems, and a lot of the problems that they see, in fact, do impact health: housing, employment, water and sanitation, roads. Those things impact health at the end of the day. And actually, they impact health more than sometimes what we want to do at the community. So we want to change the perspective a bit as well.
You know, I'm sure people are right on board with that, because working along with the village leaders, they would know exactly what the needs are, because these are the ones who are firsthand dealing with their community. But going over to Segu with PROBATES, working along with mothers and children in Barcelona, what is that like for you, a new experience coming to Belize and working along here with mothers and children? What is it like for you?
Okay. We have been working in 9 countries already with the Global Laboratory Initiative in Africa and Latin America with different organizations, and in each country women and children looks the same, but it's not the same, because there is a culture, there is some traditional beliefs. So we are very flexible on that. So when we arrive to a place, we identify, we do this needs assessment trip, we talk with the people, we talk with the communities, and we realize what the needs are, what their culture is, and we try to adapt to those cultures. So, for example, for mothers and children here in Belize, we know that we have to improve maybe the delivery at the health center instead of home delivery. I agree with them that we have to work with community leaders, traditional birth attendants, also even with the traditional healers, because there are some of the things that works, and I agree with the traditional medicine to complement some of the modern medicine, but there is not, we are not against. We have to involve them, to have to work together for the benefit of the population of mothers and children here in Belize. So we are very impressed about the work has been done here, about the communities, how they are involved in the health care delivery, and we want to improve and we want to contribute, because PROBATES Foundation is not only a donor, we are a technical support team for UNICEF or for the Ministry of Health, and this is something that sometimes it's not easy to understand and sometimes it's not easy to work out, but the idea is we give the support in terms of resources, but we give also the technical support in terms of laboratory, in terms of engineer, in terms of international health support for the program.
Now, let's demystify some of the lab work that we're talking about. What type of technical or specific tests will be able to be conducted within these facilities?
We identified during the visit, the needs assessment visit, that in some areas, for example, in Dandriga, what we are going to do is to rehabilitate a space, because the lab is already there, but it's small, there is overwhelmed. So we're going to rehabilitate a space, very comfortable space for the staff to work with, to work on, and then we are going to complement with some equipment. Okay. But most of the equipment is already there. So, for example, in Independence, the space is there, but it's no equipment at all. So we are going to support with this equipment in terms of hematology, in terms of biochemistry, in terms of microbiology, microscope, etc. So the idea is to diagnose and monitor properly the non-communicable diseases that we have seen during the trip as well, and the visit, that is they are the most prevalent diseases here, because here it was also interesting for us to learn that in Belize you shift from tropical diseases to non-communicable diseases, and it's very clear when you visit the centers and you talk with doctors and lab technologists. So we are going to focus then on the diagnosis and proper monitoring and treatment of non-communicable diseases, and also prenatal care. So, for example, in Independence it's more about equipment, in Dandriga it's more about infrastructure and space. We are also going in San Antonio about equipment, and Santa Teresa to also rehabilitate the space and equipment. So this is the conclusion of the visit.
You'll be doing providing equipment for imaging services as well?
No, imaging service, no. Not yet. It's not our
That's the second part of it, right? See, Dr. Figuerora, you can say.
No, but I think this is the beginning of a partnership.
A long
partnership. A very big smile. I mean, I'll ask. But no, it is definitely a good place to start. And I appreciate you introducing the idea of non-communicable diseases. And when we say that, we mean diabetes or sugar, hypertension or the blood pressure, and we still have issues with cancer and high cholesterol issues. Now, one of the questions I want you to be able to answer is how having an early diagnosis within these specific communities can or should impact the quality of life of these persons in these areas, whether they're children, because children are developing type 2 diabetes, or adults.
I think, again, that it brings us back to the role that this project plays as part of the larger vision of the Ministry of Health. The Ministry of Health has identified these non-communicable diseases as key contributors to poor health in Belize. Diabetes and heart disease are the top two leading causes of mortality, of death among Belizeans. And to address that, we need to make sure that our families, our communities understand the risk, understand what drives the risk, because often it's related to lifestyle, to diet, to behavior, exercise. And these are things that can't be solved in a hospital. And so our public health education to prevent the onset of these diseases is a really critical complement to what will be provided through this project in terms of the diagnosis. Diagnosis helps people know that there is an issue, but then the data that comes from the improved diagnosis at the hospital helps us better understand the health profile in our community and shape the health education and the partnership with community to prevent behaviors and to prevent ultimately these diseases.
So if I am a worker in the banana belt and a male, mid-age, and I have been diagnosed with hypertension, what happens after that? I hear your education component. So, I mean, you tell me be more active. I work in a farm. You tell me change my diet, and I have a very cultural, perhaps, diet that I maintain. What are the supplementary services that you would hope would be able to be integrated, whether already established and just connected, but what will be the supplementary care after somebody has been told you have one of these chronic diseases?
Well, certainly you have to look at what are the underlying risk factors, of course, and that comes with a proper history, a proper clinical examination, looking at the environment where they are, because probably you also have stress, you also have diet. Most of the areas there you don't have access to the type of foods, and smoking, drinking. So those are the things that you have to look at. And in the lab support, for example, if you could look at whether their lipid profile is also off what. And so those are the things that will help you guide the kind of education and intervention that you will provide to that individual. Obviously, in a case like that, depending on the criteria, you have to provide a pharmaceutical management and treatment, and then monitor that. But more than anything else, I think it's the underlying risk factors that one has to deal with, which include some of the things that you have to diagnose through a lab. All right, so.
So you are at the beginning phase of this project. Very exciting time. Let's talk about the rollout, how long you expect to take before you have your labs created and your technicians trained, and the amount of investment that this is as well.
Okay, the project lasts for 2 years. First year is more infrastructure and equipment. But hopefully in independence that the space is already there, we only have to equip. So once we do the call for the equipment, the licitation for the equipment, we can start as soon as possible this year, 2017. Maybe in Dandriga it's going to take a little bit longer, but the idea is to start as soon as possible because we are ready. The project will start in January, so we are all there. The investment is to 250,000 euros for the 2 years, 150,000 for the first year and 100,000 for the second year, because the first year is infrastructure equipment, so it's the higher investment is in the first year. But we hope that maybe in September, October, we could start with some of the independence equipment and working at full capacity there. The training will be the second year especially, and community work also the second year.
You know, another important aspect of healthcare is actually spreading the information so folks can be cognizant of the fact. Now, what is the Ministry of Health doing along with Unicef in terms of rolling this information out? One of the biggest part of healthcare is actually reaching out to the youth. Now, why I say this is because these are the folks who actually take these things for granted. But at the same time, they should know that, you know what, things are being rolled out as we speak. What is the Ministry of Health along with UNICEF doing in terms of getting out to these people and getting information to them?
Well, regionally, I mean, that's part of the day-to-day operations for the Ministry of Health. In the regional management team does outreach to schools. But in terms of this particular project, I think we haven't really started making people aware or the public aware. This is a start today. But I think with time, as the investment goes in, as we organize ourselves better, I think the information is going to be shared with different community leaders, with the different schools, with the different communities. So that will be shared along as part of the process.
And what we can do through schools, again, we already have information about the health status of children, of families, from the different data that we talked about a little bit earlier. And we aren't going to wait until the project has started training lab technicians and improving the infrastructure to engage with children through the school curriculum about diabetes, about hypertension, heart disease, and about the lifestyles and nutrition that needs to be improved in order to prevent these outcomes. So already through our support with Ministry of Education and in partnership with the Ministry of Health, through the Family Life Health Education curriculum, we're making sure that as UNICEF we support quality education, not just quality education but retention of children in school to make sure that they have the opportunity to hear in a safe and supportive environment about these critical aspects of health, so that they can be more proactive in protecting their own health and being advocates for good health in their families and communities.
I think I mentioned in a previous session that one of the things that we want to do, one of the big things that the ministry wants to do, is to be able to do a social marketing, national social marketing, and I call it specifically social marketing, not educational, social marketing, because I said we need to learn from the companies that sell us the products that are not good for us,
to make
and they make it look like it's a good thing for you. We need to learn from that, and then we need to package those messages and sell it to people, to the different segments of, including the youths, the older people like myself. We're set in our habits, but we need to start adopting social marketing strategies
Yeah.
to be able to sell good health.
Because it works.
Because
Yes.
it works.
Yes.
But it's not as simple as that either. It's something that we need to get the technical expertise, package it, and send it, and then a long term. It's not a one-day message or it's a bigger. So we're working on that, and that's a national project.
Allow me a couple of minutes just to divert to another topic and how it will be addressed with perhaps improved testing services. We know through the latest mix and the previous ones that nutrition still, the South is a vulnerable area for challenges when it comes to nutrition and how that factors into their growth, whether it's stunting or underweight and even in some cases overweight. How do you hope that even having access to a clinic where they can perhaps have specific tests and how it will help in that area?
Yeah.
Well, we also had a good discussion yesterday
Because maybe
about
if the
this.
mother sees that your child has extremely high sugar or something, I mean, that's how I would see it from this end, but I'm sure you spent more time looking at this area.
You have the undernutrition, so you have the
Deficiencies,
anemias
yeah.
From both sides.
From
Yeah.
both sides, right? And the particular thing in the South is that at the start of life they probably are undernourished, and then very quickly go into obesity with the access to sugary drinks, and so we were talking about that, the transition. We've been able to address at least the very early part of it with the introduction of Incaparina through the Ministry of Health, and so we've made a dent there where we used to have significant acute malnutrition. I think we've kind of made, and promoting breastfeeding has made a dent. Now the other portion, which is access to good nutritious foods, a lot of it has to do with the education, informing people what are the good foods that they need to access, as opposed to going and having a soft drink or in school. But again, that's sometimes these are the things that go along with development.
Yeah.
When you've made you've increased access through better roads and everything, what you see is a lot of little shops cropping up, but you don't get a vegetable or a fruit there. What you get are chips and biscuit, and that's what you are making accessible to kids and the population. We need to address that.
Changing habits is the most difficult thing, and it takes generations to change. We have been living this situation, and we are still living in Spain, in Europe, in many countries in the world, so we have to educate, but it takes long. Changing behavior is not easy, so we'll try to help and work together to make a difference on that.
Let me tell you a quick little story in Santa Teresa, because I know Santa Teresa. They've been to Santa Teresa. The last time I went to Santa Teresa, you go in eventually. We didn't have electricity at that time. Now we have solar panels for this. You're looking for a place where you could eat, and you have a little shop. And you get any biscuit you want. You get any soft drink you want. You get a soft drink from across the board.
Yeah.
Of course.
Available, but you can't get anything else.
That's it.
That's it.
Yeah.
That's it.
Yeah, which means there's a demand in the area.
And you've touched on exactly what I wanted to get to, which is that by improving, you asked how will improving diagnosis improve the behaviors. If we improve diagnosis, we're directly improving the quality of our service. It's one of the aspects of our service that we can readily use to measure quality. If we improve the quality of our services at health facilities, we increase the confidence that communities have in these health facilities, in the health services. And by that confidence, we then improve demand for services. At the facilities, the family can access counseling on nutrition, counseling on exercise, and other how to manage underlying risk factors for poor health. And so that's one of the things that we really are targeting to see: improved demand, and then therefore improved partnership between families to continue to create health in their communities through changes in choices in lifestyle.
All right. Well, we want to say thank you for having you all stop in and share a bit about this project. As you pointed out, the rollout started in January, and it is set to be completed in 2 years. So you're very early, but it sounds like you're already on the ground getting started. So thank you for stopping in and sharing the details.
Thank you.
Thank you so much.
That's right.
We are going to go ahead and take our break, and when we come back, we'll be joined by a group of international ambassadors. They're students from Belize High School who recently returned from a trip to Taiwan, and they'll be telling us all the details about it. That's coming up after the break.